Well, welcome everyone. We're really glad that you could join us for a very unusual discussion of the reality of COVID relief in India. I'm Richard Dasher. I'm usually working at Stanford University, but today I'm wearing my hat for Silicon Valley Global Health. I'm one of the directors of Global Health. We're very happy to co-present this program with you and also with the Aaroogya Foundation. Where did Vida go? I'm looking for Vida's picture. There you are. So I'm going to make Vida the host so that Vida can share this video on YouTube.
Thank you, Richard.
So again, everyone, welcome to the program this evening on the reality of COVID relief in India. And I'd like to go ahead and turn over the microphone to Dr. Priyanjali Datta, who is the founder and CEO of Aaroogya Foundation, to explain what's going to happen with the program today. Pri, the floor is yours.
Good morning and good evening, everyone. Today we are here to talk about some of the realities of COVID-19 situation in India. It seems like the news right now is showing that we have achieved the peak and we are coming down with cases, which are getting lowered in major cities like Delhi and Mumbai. But we are here to talk about what the real situation is in 70 or more % of India, because in a country where rural habitants are at maximum, it is very, very difficult to comprehend the actual data. So we have 4 very accomplished group of entrepreneurs here with us and a doctor who will talk about the actual situation happening on ground from various parts of the country like Punjab, New Delhi, and Mumbai, Maharashtra, and also Kolkata. So I welcome the speakers today to talk about some of the facts that I have been gathering since yesterday from various parts of India. Yesterday, Assam here in India reported 5,699 cases, which is really high for a small state like Assam, which is situated in the northeastern part of India. And talking about a large state like Tamil Nadu, which has reported 33,800 positive cases, which is a very high number. Kerala has also reported 28,800 new cases with a positivity rate of 19.95%. So these are some of the very shocking numbers which is there right now happening in various parts of the country. Since the second wave has hit us, we have lost a total of 513 doctors across the country who have lost their lives to the second wave. What we want to emphasize here is that, number one, definitely about the vaccinations, that it must pick up speed and mobile and mass vaccination drives should be introduced. India should also closely track new variants or upticks in infection using real-time epidemiological and sequencing data. And also we should use methods like pool testing and wastewater testing to see the level of infection in communities and save time. I would also request all the speakers today to make their appeal in 5 minutes about what they're doing and how can we help you, how can the group today help you in doing what you're doing. Speaking about the first speaker today, Smarita Sengupta, she is the founder of Destiny Foundation, whose India-based mission is has its genesis since 2007. It has helped educate, employ, and empower many young women who were victim to human trafficking and have experienced exploitation and servitude. Smarita was nominated for CNN News 18's India of the Year in 2016 and was featured in Facebook's One India show on Republic TV and Femina magazine in 2018. Welcome, Smarita. The stage is yours.
Yeah, thank you, Priyanjali, and good morning and good evening to each of you. And I'm very pleased to be here. It's such an important issue. So Yeah, I'm in Kolkata. So, and I run a non-profit and a social business which caters to the victims of child trafficking, mostly creating livelihood opportunities and their safety, security. And I don't know how to start today. I personally, maybe it will be to some extent my personal experience for last 2 weeks. And I would give you some data which I was looking into for Kolkata only, because Priyanjali, you're already talking about the larger Indian thing. So we see from the record that we have around 1,26,376 active cases right now. And the curve has suddenly gone up from since 8th of May. And we have deceased around 14,674 for COVID-related death. And recovered cases are showing high, around 11,60,000 something. It's really high. But I don't know how much it is. Maybe you could say it's my mental blockage that when I look at the data and the experience I had for last 2 weeks, or talking to our friends, marginalized people, I have a very different picture. So I don't know how much the data they're able to get the authentic ones. So this is the situation, and for and my experience, I think it would help you to get some real time, like what the people are going through during COVID crisis. We have like experienced inflated ambulance rate, from which is supposed to be 700 INR to 6,000 rupees, which means 8 to 9 times high when I wanted to access ambulance. And hospital bed is still a difficulty. Even corporate connection failed. I'm talking about multinational giant. The person who my brother-in-law, I will take that experience only, it's very fresh, and he was unable to get a proper multinational hospital. And then accessing online doctor's appointment is also not flawless or smooth. We had to use our personal connection, and then we were able to get some the doctor's suggestion. And the hospital beds are also expensive. Like we had to acquire 1 lakh rupees. If you convert to INR, USA, it will be divided by 70. So it is 1 lakh rupees deposit, which means 4 people had to swipe their ATM card to get that kind of money within 10 minutes, 15 minutes. So, which is, even if you considering we have the money, so it has to be 4 persons. So because they don't allow you more than 20,000. So these are the, very real practical things we have seen. And when I visited hospital, I met at least, that's why I spoke about the data and the reality seems big gap in between. So I met at least 10 to 20 deceased family in a small nursing home where I spent around 24 hours or little more than that. And the crematorium I visited, I saw at least 100 dead bodies lined up. So that only 4 or 5 hours I spent. And also, I don't know if you're aware of the news that many of the family members are leaving their, the patient in the hospital, and they are disappearing because they are unable to, pay that kind of downtime money. And coming back to I'm talking about people like us who have the minimum connection network and also money to some extent. And regarding the marginalized community we work with, we are noticing huge mental trauma they are going through. Huge. And a mental trauma is really, I would highlight that in capital. One of our beneficiaries, she was affected with COVID, and we had to depend mostly on volunteer support. We had to look for. Definitely, there are some schemes available in the government. I won't say it's not there. It is there, but accessibility is zero. Accessibility is zero. They don't know. They need help from us to guide them. So this is it. And I think as a solution, what would I say? Definitely, we need a lot of tasting. Priyanjali, I think what you were trying to, highlight, that tasting is very important. If you look at the red light area, we work very closely with. They have I really don't have an answer, but how do I manage that emergency within 10 hours or 12 hours? So this is it in a nutshell. I can answer any questions if you have.
Thank you so much. We'll take up the questions after all the speakers have spoken. I will now request Dr. Shikha Yadav. Talking about Shikha, she is a pediatrician and working with the government hospital here in New Delhi called the Late Harding's Medical College and Hospital. She is, a real frontline COVID-19 warrior who has treated many COVID-19 patients during India's recent infection explosion, and has also helped Aaroogya and Aaroogya's patients. She has worked day and night. So I want to appreciate you, Shikha, and the floor is yours.
Thanks a lot, Priyanjali. Am I audible?
Yeah.
Okay. So good morning, everyone. So let me just begin by introducing myself. My name is Dr. Shikha Yadav, and I work as a resident doctor in one of the finest institutes we have in our country, Lady Harding Medical College, Delhi. So in these 5 minutes that are given to me, I think I would like to focus on important issues that I think we should lay our emphasis on. So first, I would like to start with first I'll tell you what are things I want to talk about. So first, I would like to discuss the recent trends that we've seen. Basically, the difference between the first wave and the second wave, and now how hard it's hitting right now. So in the second, I would like to talk about the current situation in the government hospitals, like ma'am already has talked about. And in the third, I would like to talk about the target population for making the early diagnosis. Then how do we prepare for the third wave? And then myths regarding vaccination. So basically, what the trends that we have noticed in our government setup is, like, unlike the first wave, like ma'am already mentioned, we have an exponential rise in the cases in the second wave, which is why we can say that the infectivity is much higher. And also, like in the first wave, mainly the geriatric population were at risk, or maybe the ones which were having comorbidities. But in this second wave, it's affecting the working populations equally. And not just infectivity, I would rather say that even the mortality rates have gone higher, because and it's a new thing for all of us, even the doctors. It's a new thing for us. We are also day and night looking for better drugs and all. So basically, moving to the current situation in government setup, like I'm telling you, we have a limited healthcare resource, be it the number of beds or oxygen support. So we've tried to manage a lot of patients at home. Like Anjali was saying, I used to take call day and night, and a lot of my colleagues are doing the same thing. So we've tried to manage a lot of asymptomatic or mildly symptomatic people at home, so that we can save our resources, beds, and oxygen support for the ones who actually need admission. And also, a problem that I'm facing right now these days is a lot of people self-medicate. They do not consult a doctor, probably because problem in accessibility. But then what they usually do is they take the medicines themselves, and then they end up coming to OPD saying, "Ma'am, we have already tried azithro, we've already tried oxy, we have tried a course of steroids." Then there was no need. So basically, now the problem is a lot of people have already taken steroids, a lot of steroids, without consulting their doctors. And now the problem is that we're having a lot of fungal infections, which are obviously difficult to manage because it's the first time for us also. Then again, in the third wave, I think the best way to prepare is to identify the target population, which according to me is the underprivileged section of the society, because they make the major chunk of our country. First of all, they're not that educated, they're not that aware. They do not know about the signs and symptoms of the disease, or probably how can they prevent it, or what is the prognosis, why they should go for early diagnosis or early treatment. And also, a lot of deaths are happening because they're not aware. The accessibility is of course not there, but then they're not aware, or there's a social stigma associated. So I think right now the best way to prepare for the third wave is to make them aware, because they make the major chunk of the society. If then the only way to get down the numbers is by identifying them. So I would like to share one experience. So day before yesterday, in my OPD, one patient came and she was like, I do not want to get vaccinated. I asked her the reason. Then she was like, one of my neighbors got vaccinated and he still lost his life. Or somebody from her neighborhood was saying his side effects are too much. So I think right now, because there's a lot of I would say false information, so we need to correct them. We need to tell them what is the risk benefit ratio, why they should get vaccination. So like Priyanjali also mentioned that right now, the important thing is vaccine drive is, I know it's a very important thing, but we have to educate people why they should get vaccination. They're not coming up, they're not turning up. So I think that's how we are going to, that is my solution to being prepared for the third wave. Thank you.
Thank you, Shikha. Thank you. I will now request our third speaker, Sukhmeet Singh, founder and CEO of A2P Energy and Energy Harvest, winner of Global Makers Challenge 2019. Mr. Singh has over 16 years of experience in the areas of IT, analytics, agriculture, and strategy. Through A2P Energy, Sukhmeet is also engaged with Aston University in the UK and European Bioenergy Research Institute in setting up bioenergy plants in Punjab to convert paddy straw into energy products. In the past, Sukhmeet has worked as an associate director at the Indian School of Business and worked on research projects with the government and corporations in the areas of IT and agriculture. Welcome, Sukhmeet. The floor is yours.
Yeah. Good morning and good evening, everybody. Thank you, Dr. Priyanjali, for inviting me here. I am Sukhmeet, so I run two organizations, A2P Energy and Energy Harvest Charitable Trust. We started our work around solving the crop residue problem burning in India. So there is a huge issue of crop burning which happens every year in North India, which causes serious air pollution. And some of the seriousness of the COVID-related patients also, I saw some articles that air pollution also kind of makes the cases worsen when the person is already infected with air pollution and has bad lungs. So we started our work in 2016. How do we solve this air pollution challenge? I've been reading about how the bad air is getting problematic even in the lungs of the kids. So that is where we started our work. The not-for-profit arm, which is the Energy Harvest Charitable Trust, primarily we work with farmers on outreach activities, training programs for how to manage farm waste and not having to burn the farm waste. We also use a good amount of technology in our approach. We use satellite data to identify high crop burning areas and then do outreach with the farmers. And the other arm which we have is private limited that focuses on the biofuels. Coming to the COVID situation in India, as and when we had the cases rising, we were just exploring what do we do to help ease out the situation. We had no linkages to the healthcare sector as such. But we had some of my close friends had their relatives actually expire because of the lack of oxygen. So what we started with was that let's do a fundraising and an initiative around oxygen concentrators. So my family in US, so they had procured oxygen concentrators. Through our trust, we got it in India and we were distributing to various NGOs and other people who are working on the ground. So that was around supplying oxygen concentrators and oxygen channels for that. Another interesting thing which we started during COVID was when we visited, so I personally also visited a lot of these COVID centers to explore where is the need in terms of oxygen cylinders or oxygen concentrators. We realized that there is actually a big problem of when the wave was going towards the rural areas, a lot of people are coming back to the cities for getting their medical done. There were few centers which had opened up in Chandigarh, where I stay in North India, which were being opened up by some not-for-profit NGOs focusing on healthcare. There we saw a lot of people coming from rural areas because these centers were giving free of cost services. As far as people from Mathura, which is in UP, or in Delhi, they started coming into these kind of centers where they could get free access to the healthcare facilities. We realized that when we'd gone to these centers, there were people who were actually family members who had got their patients admitted to these COVID centers. They had actually no place to stay. We saw families living under the trees for 4 or 5 days. We had also rains in between in the month of April and May. So that was a very hard thing to actually see what's happening on the ground. We've made a small video for our efforts. I'd like to show you that. Let me know when everybody is able to see the first screen of the video.
Yes.
Yes, I can see.
We have no sound. We have no sound from the video, though.
Okay, actually, that's fine. So,
यहाँ पे जो रुकने के लिए हमारे लिए अगर यहाँ पे थोड़ा सा अगर व्यवस्था हो जाए 4-5 कमरों की ऐसे ही टेम्परेरी तो बहुत अच्छा रहेगा यार।
हम दिल्ली से आए हैं, हमारा पेशेंट है अंदर, तो यहाँ जो रुकने की थोड़ी व्यवस्था हो जाए जो पेशेंट के साथ आते तो बहुत अच्छा होगा।
ਜੇ ਕੋਈ ਬਜ਼ੁਰਗ ਘਰ ਦੇ ਵਿੱਚ ਇਕੱਲਾ ਹੈ ਉਹਨੂੰ ਘਰ ਚੋਂ ਲੈ ਕੇ ਆਇਆ ਜਾਏਗਾ। ਕੋਈ ਜੇ
ਇੱਥੇ ਬੜੀ ਦੂਰ ਦੂਰ ਤੋਂ ਸੰਗਤਾਂ ਆਉਂਦੀਆਂ ਨੇ ਤੇ ਜਿਨ੍ਹਾਂ ਦੇ ਰਿਲੇਟਿਵਸ ਅੰਦਰ ਹਸਪੀਟਲ ਦੇ ਐਡਮਿਟ ਨੇ ਉਹਨਾਂ ਦੇ ਅਟੈਂਡੈਂਟਸ ਵਾਸਤੇ ਸਾਡੇ ਵੀਰ ਜੀ ਸੁਖਮੀਤ ਸਿੰਘ ਜੀ ਤੇ ਇਹਨਾਂ ਦੇ ਸਮੂਹ ਜੱਥੇ ਵੱਲੋਂ ਉਹਨਾਂ ਦੇ ਬੈਠਣ ਤੇ ਆਰਾਮ ਕਰਨ ਵਾਸਤੇ ਬੜਾ ਹੀ ਪਿਆਰਾ ਇੱਕ ਜਗ੍ਹਾ ਜਿਹੜੀ ਹੈ ਬੜੀ ਇੱਕ ਨਵੀਂ ਸੋਚ ਦੇ ਨਾਲ ਇੱਕ ਬਣਾਈ ਹੈ।
ਸਰਵ ਹਿਊਮੈਨਿਟੀ ਸਰਵ ਗੋਡ ਦੇ ਚੈਰੀਟੇਬਲ ਟਰਸਟ ਨੂੰ ਇਹ ਸੇਵਾ ਕਰਕੇ ਦਿੱਤੀ ਹੈ। ਤੁਸੀਂ ਦੇਖੋਗੇ ਪਿੱਛੇ ਬਹੁਤ ਹੀ ਬਿਹਤਰੀਨ ਗੱਲ ਸੁਣਿਓ ਜੀ। ਇੱਕ ਭੈਣ ਜੀ ਕਿੱਥੋਂ ਆਏ ਹੋ?
ਅਸੀਂ ਜੀ ਰਾਮਗੜ੍ਹ ਤੋਂ।
ਰਾਮਗੜ੍ਹ ਤੋਂ?
ਹਾਂਜੀ।
ਹਸਪੀਟਲ ਰੈਫਰ ਕਰਾਂਗੇ, ਸਾਡੇ ਕੋਲ 3 ਘੰਟੇ ਹੋ ਗਏ, ਬਹੁਤ ਸਟੇਬਲ ਹੋ ਚੁੱਕਿਆ ਹੈ।
Yeah, just to give you an idea that, apart from though we are setting up so many COVID facilities, the other parts of some of these chains where we can take care of the people who are coming along with these, because nobody actually wants to get these patients or the family of the patients give accommodation. So that was a challenge. We did also check with the municipal corporation. They said setting up these kind of centers will take us long approvals for us. So it's better to have something temporary for these family members. So that was our initiative. We have now lined up another 4 of these kind of centers where we are setting up such facilities. So that's our at least initiative, what we have found out. Apart from the oxygen, this was the need, and this is, from the raw material which we had, we were able to build some of these facilities. And now we are raising some more funds to expand to more of these centers in and around Chandigarh and Punjab. So yeah, I think that's it from my side.
That's wonderful, Sukhmeet. Thank you so much for sharing such an innovative initiative that you're doing. And thank you for what you're doing. I would now move on to our final speakers, Jehaan and Sukhmeet. Finally, so I'm very pleased to introduce Jehaan Kotwal and Sukhmeet today to everybody. Mr. Mane and Mr. Kotwal founded the Humsafar Driver Safety Foundation, which provides technological solutions to prevent road accidents in large truck transports. Mr. Kotwal is a serial entrepreneur with vast experience with startups, led him to found JFK Transporters, a trucking and freight company whose work has recently been critical to transporting oxygen to healthcare centers in India for COVID patients in critical condition. His work with JFK Transporters earned him the Youth Transporter of the Year award by Ministry of Road Transport and Highways in 2016. Mr. Mane is an experienced product management professional whose prowess is IT and computer science, and has allowed him to work at a number of tech companies as an analyst, app launch team leader, and app designer. Welcome, Sumit. Welcome, Jehaan. The floor is all yours.
Thank you. Thank you, Priyanjali. Good morning, good evening to everyone. And thank you so much for giving us this opportunity to talk about what we're doing. Let me just begin with, just sharing a couple of incidences of that we've experienced over the last few weeks. My own staff members, and we move oxygen for almost all the big, oxygen companies across the country. And Altaf, who works with us, unfortunately got COVID, immediately rushed to UP. And when I called him and we were asking him, what do you need? What can we help you with? He was asking for just one cylinder of oxygen, which, as even though we transport oxygen, for us was difficult because we don't do it on that side of the country. And we tried our level best. And eventually he was able to get one tank of oxygen for maybe a few days after spending 70,000 rupees, which is almost more than 2 months of his salary. And it took him 3 days to procure that tank, as well as make sure and refill it for, excess amount of oxygen as well. So this kind of experience and such experiences over the last few weeks, we realized that actually the challenge in India, like Sukhmeet was mentioning, as far as oxygen supply is concerned. So we did a lot of research just to give you a stand around, and how do we make the oxygen supply more efficient in the country? Currently, as far as manufacturing is concerned in India, we have a lot of oxygen being manufactured. The problem is not the manufacturing of oxygen, it's actually a supply chain issue, which means that the cryogenic tanks in which these oxygens are moved need to have a faster turnaround time to be able to reach the hospitals or these oxygen centers. So essentially, what our role is, we're working with the Ministry of Commerce and the Logistics Skill Council. And what solution we had, and we have the technology available to do this, and hence we immediately leveraged the road safety technology that we had, and we pushed it into the oxygen trucks, movement. Essentially, what we are doing now will be a mobile application that goes onto the truck drivers' phones, which insures them, incentivizes them, and also will be helping in their vaccination. Now, why are these truck drivers who are moving these oxygen cylinders important? And how will it improve efficiency, and what can it result in? Last 2 weeks ago, we had about 11 deaths in AP due to a half-an-hour delay in the oxygen truck reaching the hospital. In April, we had 24 deaths just because there was a leakage in oxygen in Nasik. These kind of incidences that are just very few reported, just by the way, that's one thing which we are very unfortunate to see, is that we don't see a lot of the bad stuff here, and it's quite subsided with the numbers like doctor was talking about as well. And so we're going to see, even probably in the third wave, far more of these incidences around oxygen supply. And so how do we close this, and what is the solution for the challenge? What we realized is that these 2,000 tanks that run across the country, if we could increase the efficiency of all these tanks by even 5%, that leads to a 300-ton excess capacity per day, which can save about 2,700 lives a day. And I'm talking about ICU patients. Now, essentially, if to really go deep down in understanding the root issue, as I was mentioning, is the supply chain, right? But what was more important is the guys who are driving these trucks to these hospitals, coming back, probably working not less than 16 hours, and are the hidden frontline warriors, mind you, in this whole battle, completely neglected, not insured, not looked after, not even respected for the work that they're doing. And essentially, our role, as a foundation, is to work towards not only giving them that extra slight incentive. So we've made it on a per kilometer basis. We give them 30 paisa per kilometer, which is hardly, if they're running 10,000 kilometers a month, it's hardly 3,000 rupees in their pocket. But for them, that's a big deal. And so that 3,000 rupees extra encourages them to drive a little bit more, maybe that 5% more, do that extra delivery, do that extra pot of oxygen. So that's one smart way which we've figured out on how to incentivize them. The second thing what we've done is also making sure that they're insured. Because the thing is, these drivers across the nation, and especially this is critical for the third wave, these drivers, if they need to be trained, it takes a month. And if there's a shortage of these drivers, obviously there's going to be a lack of the, again, the transportation is going to get affected because training them is an issue. So we're also trying to bench about 500 drivers across the nation as well, to make sure that they're at least kept ready. And in case the third wave hits us, they can be mobilized immediately. Simultaneously, of course, vaccinations, a challenge across, at least for us in the West, and we're seeing this predominantly, is the vaccination not being available. And so hopefully when that does open up, we plan to do a much bigger vaccine drive for them and immediately get them vaccinated so that they can keep doing their duties and making sure that oxygen is supplied across the nation on all the hospitals. That's essentially what we're doing. We're using technology in terms of, it's a mobile application that's easily downloadable. It's very scalable, very fast, efficient in terms of transparency. And we're making sure that the drivers are taken care of from an insurance point of view. So these are the three things. I would have loved to share a presentation, but due to a shortage of time, maybe if any one of y'all are interested, happy to do that. But thank you so much. And any technology questions, Sumit is our tech product lead. So please, you're free to ask him those as well.
Thank you, Jehaan. Thanks for your wonderful insights and talking about the frontline warriors, the truck drivers who are playing such a critical role during COVID-19. I would now request Dhruv to talk about a little bit what Aaroogya is trying to do and also about the COVID-19 situation currently. So Dhruv, if you can unmute yourself and talk it a little bit.
Hello everyone. So I'm the co-founder of Aaroogya, and during this COVID period, we are actually trying to go for screening of women across the country, and I think it's much more relevant these days because past 1.5 years we haven't had the hospital space for people to be diagnosed for other diseases. For be it cancer, be it any chronic disease, be it diabetes, be it hypertension, people are suffering. And it's been almost 18 months since people have actually gone to a hospital and have had follow-ups. So that's something which we have been looking at, and that's something which we are trying to do on ground. As far as COVID-19 is concerned, this is my personal opinion on it, that the rate at which it increased and the rate at which it is decreasing, it was just too quick for anyone, for anyone to react at the right time. And like by the time Delhi was on its peak and was beginning to decline, government procured all the cylinders, government procured all the cryogenic tankers, everything was done. The cases had already started decreasing. So it was just too fast for anyone to react to. So that is something which I have understood. And as far as third wave is concerned, anyone and everyone who hasn't had COVID or isn't being vaccinated, can be hit in the third wave. It might not be only children; it might be other set of people also. And we need to look at our as Jehaan and Sukhmeet have emphasized. We need to look at the people who are at the forefront of this COVID war, because until unless the backbone is there, we will be able to handle this. But if people get COVID, how it happened in Delhi, almost every doctor in the family, they had COVID. I know people, I know hospitals wherein nurses were actually working when they were COVID positive because they just didn't have enough staff. So we need to look for our frontline healthcare workers. We also need to look into our frontline logistics, and we also need to look into the other people. The people who take part in the maintenance of hospitals, who take part in the maintenance of these logistical parts. they are very, very important, and we need to look into them, and it's very, very important. Priyanjali, you want to comment on something else?
Sure. And lastly, what I would like to talk about is that how important the two crucial things are right now. One is to strengthen the backbone of the healthcare system, which can happen with the paraphernalia like what Jehaan and Sukhmeet has talked about, and what Dr. Shikha and Smarita has pointed out. We need to ramp up the testing capacity so that the unreported cases can be reported as much as it can be. And the second is mobilizing the oxygen and the vaccination drive. So these are some crucial things that we need to focus on, because COVID-19 is not going anywhere anytime soon, and we need to be prepared and do it very proactively. So I would request everyone here to support our speakers, and we will email you about their contact details and the work they're doing, so that you can directly reach out to them and talk to them about more in detail about the work they are doing. Richard, I would now like to pass on the mic to you so that you can take up questions from our guests here.
Richard,
Thank you very much, Pri. I am, always, it's heart-wrenching to hear these kinds of descriptions. We will take a record of everyone's contact information, and especially the information about the causes that are represented here and how people can reach out and support these causes. They're all worthwhile. Several things have already come up in the Q&A that I'd like to just start to ask about. And this one really goes back to Pri and Dhruv. It would have gone to Dr. Shikha, but she's had to leave. Third wave, what a horrifying concept to know that people are already talking about a third wave. How is that being, is that being talked about widely in the medical establishment in India?
Yes.
Dhruv, or Pri? Yeah.
So Richard, regarding third wave, people are already so scared of the second wave, that they are already looking at something which is called as third wave. Unfortunately, we got overwrought, and we did not look at the basics. The first law of the basics is that the second wave is almost always more deadly than the first, and the third wave which comes is almost always lesser than the first wave itself. So it happens, and it's a basic of a pandemic. It's a basic of the epidemic which happens. And this time around, it was just so fast for anyone to react that by the time people started reacting, the wave had already started receding. As far as the third wave is concerned, because with the type of population India has, even a small wave will have a lot of casualties. And the unfortunate part is the people who are out of the vaccination bracket, and the people who cannot afford a vaccination or are not accessible to vaccination will be the ones who will be the most infected. I am not sure about only, there have been reports where only pediatric patients will be suffering from third wave. But I am pretty sure anyone and everyone who is out of these brackets, they will suffer from COVID-19 again if it happens this way.
Okay, thank you. Pri, comments on that?
Pretty much what
Maybe,
Dhruv said.
Go ahead.
Yeah, pretty much what Dhruv talked about, Richard. The third wave will definitely come because pandemic has this basic rule of first, second, and third wave, as we have studied. I'm not sure this is the first pandemic we all are encountering in our lives. But even if it doesn't come, right, or whatever the scenario is, the kind of population India has, which is equivalent to a continent in my mind, we must proactively strengthen every aspect of healthcare now, so that we can at least do our best whenever the next emergency explosion happens. So
Okay.
Yeah, that's my point.
Yeah, I think the next thing I'd like to ask about, really this is to Jahid. Jahid, transport of oxygen is one of the things you talked about. There are special needs for refrigeration and transporting vaccines and so forth. What's that situation looking like?
So I think the first question, honestly, is where is the vaccine?
Jehaan.
Yeah. So the first question is, where is the vaccine? That itself is not available. But let's assume it is. The cold chain logistics part of the transportation of the vaccine isn't such a big challenge, because one truck can hold a big amount, like lakhs of doses. And so essentially maybe a set of 12 or 15 trucks could vaccinate the whole city of Mumbai. So because we've already had a large, for vegetables, etc., moving pharma products, we have the cold chain facilities. The logistics of the supply chain and cold chain for vaccines is not such a big challenge, as well as the fact that Serum itself has, which is the largest vaccine manufacturer here, has its own set of trucks also. So the moment the vaccine was being manufactured, the logistics and supply chain was also being looked at for the transportation of this as well. And so that's pretty much taken care of. It's not really a problem. So you're not going to hear about that as an issue. The bigger issue is, like we said, reaching the oxygen in time. That's where the part is.
That's it. Sukhmeet, from your standpoint, out in the field, you need these structures, you need the oxygen to be produced. There's a lot of different things that you need. Which are the ones that you would prioritize at the top?
So oxygen, at least what we have seen now in our area, they have opened up the supply of oxygen. I guess we are okay for oxygen. But going back to what I mentioned is that the problem now is facing in rural areas where Dr. Priyanjali also mentioned people sometimes they even don't want to get tested. And also there is a lot of stigma around this. So what we have seen is people, instead of going to local small healthcare centers, they are coming towards the cities and get their patients admitted. So I guess taking care of their families, we have seen for their food, for their shelters as one of the key things which is still missing in the whole infrastructure line. Oxygen, yes, there was a very dire need in the starting, which I guess what we have seen in our area has gotten fulfilled. There are a lot of oxygen banks. We have also set up a concentrator bank. We in fact have also made a portal where we are putting in the concentrators of the people who have already used it, and online people can request from that. So I guess the second stage of infrastructure is what we found out was the biggest missing link for their families. Some of the families are like that every family member is infected. They are in different COVID centers. Even if one is getting free, there is actually no place to go back to home where the person can get food and also food. Getting the requirements of the daily food is also a problem, which also we've started working on. Another thing I would like to here highlight is these cities have a lot of daily wage laborers. So what is getting impacted is because of these lockdowns, these laborers they don't have enough money to actually sustain for a month or more. So we've now exploring that how do we set up food banks for these kind of people who are on daily wages. So that also is our next step, what we are thinking to work on.
Okay, thank you. That's great. And we will have your information and URL logins available to everyone later. Smarita, a quick question for you. You're in the position of working with people who are kind of maybe underserved. How do you deal with this misinformation problem? What is is there a way to get through and to really get the right information out to people?
Yeah, so it is actually a lot of job for us, for the nonprofits. We are providing the information, giving them awareness on pandemic, vaccination drive, testing, and also trying to reduce the stigma and mental pressure they are having. And so I think it is, I think, collaboration, capacity building of NGOs like us, so we could extend our service little comfortably. That is one point. And the major concern I would be worried about is for them, they're casual. Why they're casual? They're panicked, but casual because it is about death without food and income, or because of pandemic. So it really doesn't matter. Both ways, they see the end or death.
Yeah. Okay. So this is really a terrible situation. We don't have time for more than about one or maybe two quick questions. Anyone in the audience like to ask a question? I see Ayush has taken the trouble to write your question down. Would you mind just saying it?
Can I speak, please?
Thanks, Richard. Yeah, so very quickly, just like Jehaan was pointing out, right, like the oxygen logistics problem is a big one. And so we were in talks with a lot of people from the government and the industry. And we kind of came up with this idea that why not use these 1,000 liter cylinders, liquid oxygen cylinders, mounted on regular trucks to increase the fleet of our tankers, right? Because the tankers are limited. We can increase the fleet with these 1,000 liter cylinders very significantly, and we can actually do a lot of them. And this will not just help in large distance transportation of liquid oxygen, but this will significantly help the smaller areas. So right now we have actually checked up with a lot of local small areas, and they're just not getting oxygen. It's a very bad scenario. They just do not even know where the oxygen is coming. So it's a very bad scene that we can solve for the smaller areas especially. Now the question here is, we have got this approved from the Ministry of Commerce. How do we scale this up? Because if this does not scale now, then again we'll face the same issue later. And this is the most cost-effective and scalable solution of the oxygen problem.
Okay.
So this would be
and
more
that's a great question about many things, is how do you scale it up across India, right? You've got the federal government permission.
Yes.
I think part of it is information spread. Everyone needs to know, and needs to know in a distributed way. Great comment. Priti, did you want to make a comment? Was that you I saw?
Yes, Richard, I would like Priti to comment on
Okay,
situation.
Dhruv, go ahead.
She comes from, she comes from Uttar Pradesh, which has been first affected by COVID, and yeah. Priti, are you there?
Thank you so much, everyone. Good morning and good evening from Lucknow. I'm Preeti M. Shah. I'm staying in Lucknow, which is the capital of Uttar Pradesh. In brief, I would like to share my own experiences from the first wave of COVID-19 from March to 2020. Some like-minded friends have come up with a WhatsApp group. Why? Because that was the time when livelihood was more affected. And since then, now we have seen that it has come from livelihood to lives now. Okay. So we all are different professionals who are working in our respective areas. Some of them are medical professionals, some of them are media professionals, some of them are grassroots NGO workers. But we have the same agenda, same vision to serve the underprivileged people more, because they are the people who are not, aware that where they should go, from where they'll get the health, sorry, I think somebody's video is on.
Yeah.
So they don't know.
And I'm not sure, I'm not the host anymore, so I can't do anything with this.
All right. So I'll just continue. So now what I'm telling here is in the second wave, what we have experienced is, though it was from oxygen to getting bed in the hospitals, medicines, these were the things which were keeping us on toes. But now gradually this has shifted. And in between, it was plasma as well. Then there was a communication that plasma therapy is not very effective. So later on, the plasma request were not tackled by us. What we were actually doing is we were providing the real-time info to the people who need it. How? We have a group of volunteers. They were working and verifying the info which is coming that, okay, fine. Here you can go and you can get an empty oxygen cylinder.
So
From
pretty,
here you
really
can fill
quickly,
it.
pretty, really quickly.
I'm so sorry.
What's the
So you can fill it.
What's the ask? How can people help?
Okay, so if I'll ask for the ask is the real help is required in the communication. Real communication, you know, the fake information is circulating a lot. So I think we should focus somewhere on the communication material, especially in the language which is used by the masses, not in English, right? People who are bilingual, those kind of people are required to communicate small important things, like only vaccination is the solution for the third wave, nothing else. And how the people who are not using Android phone, who are not having the access of these smartphones, how they can get themselves registered and get them vaccinated. There is a hesitancy. People are,
Okay.
Afraid of it.
Great, thank you. I hate
pleasure.
to push things on, but we've got to move.
Thank
Dr.
you.
Mishra, I
Thank
think
you
you
so
had a question or a comment, Dr. Rayaman Mishra. You're muted, so.
Yeah, I think Richard, if Jehaan could answer to Ayush's question in the meantime.
So Ayusha, I think Ayusha's question, I thought it had been addressed, but yeah. Ayusha, did you have more on that? About the liquid oxygen?
No, so the question just is like, is there a way to kind of scale it? Like, is there state governments, etc., coming in, like hospitals, etc.? Yeah, I'm sure like Jehaan might have more understanding of that part. So, yeah.
Okay, so I think that unfortunately, we're trying to hold to an hour, and so we need to be moving forward. Pri, I think I'd like to ask you to kind of sum up sort of how we'll proceed with communication from here so that people can get the information about these causes and so that we can really share information with each other.
Sure. So we will, after this call, share an email with everybody who is present with us here about the details of information about the speakers we had today, their cause, how can we support them, their donation links, and also their contact details. After that, you can take up the conversation with the speakers directly and reach out to them for the cause you want to support. Also, I would now request Martin to sum up today's meeting and talk about a little bit about Silicon Valley Global Health.
Thank you, Pri. First of all, thank you. Thank you to all the speakers and the presenters. I learned a lot. It's quite overwhelming sitting here in Silicon Valley and fully vaccinated. And I feel at some point, I feel very far away from you all. On the other hand, it is personal. It is very personal. We all know people who've been affected, impacted, or who have died from COVID. Our network is a global network, and it is personal. So even from Silicon Valley, California, we want to assure you, you are not alone. We are here for you, and we advocate for you. So that was what I was thinking about listening to you. As like, how do we advocate for more support for India? How do we raise awareness on how dire the situation is, on the urgency of the situation? how do we reach out to the people who have the means, who have the tools, who have the resources, and who are not stepping up? So that was first and foremost going through my mind while I was listening to you, like, how do we give you the support and the resources you need just to help you in what you're doing right now, because you all are making a huge difference, and we applaud you for that. We stand by you, we advocate for you, and we want to support you. One of our, I'm looking at the pictures for a little while. Oh, there he is. So we have Gabriel Farhadian with us today. He's a fabulous volunteer of Silicon Valley Global Health. Gabriel has been summarizing our events and writing short summaries of each event. He will make sure that your names, your contact information, the links are included and will be provided to all of you. We have with us Vida Patil, who is streaming this event through YouTube. So we'll have the link available. It will be for you to use and to share among your network as well. So that is our small way of supporting you and providing with a little bit of resources and material that you can use to further your causes. As pre-mentioned, we are Silicon Valley Global Health, a nonprofit in the USA, with the purpose of supporting the efforts of Aaroogya in India, and we hope to expand to other organizations. We are very young, we just started, and so we are very lean in resources right now. We are looking for some support here to help us launch our nonprofit, launch our website. We are looking for an executive director or a program manager. We are looking for mentors who can help us with marketing, communication, and website design. And I'm gonna do a shout out to Janelle, who's with us today, who has stepped up to help us with some of our communication materials already. So don't think there is nothing you can do. Everybody can do something. You can do one small thing with huge impact. Thank you all for being here today. Thank you for your interest. And Richard, I don't know if you would like to say a closing.
Yeah, let me just briefly mention that this is very much in the spirit of viral marketing. Each of us has our own network. Each of us has our own contacts, and let's share what we've learned today and the contacts that we've made today with our networks so that we can reach a much bigger group of people than we're even here today. Mm-hmm. I think it's been a really meaningful session. Martine, thank you very much for talking about Silicon Valley Global Health, kind of working backward, right? Yeah. Our four speakers, I want to thank Jehaan and also Sukhmeet and Smarita and Dr. Shika, and especially I want to thank Dhruv and Pri, without whom all of us would not have come together today. So thanks to you for participating in this, and we will call the meeting to a close. Thank you, everybody, and bye-bye.
Thank you, bye-bye.
Bye.